So we're going to do now the treatment sequence of an upper extremity lymphedema without trunk involvement. So let's keep working on the left arm. It's involved, it's swollen. So we're going to start with the neck. We're going to do effleurage. We're going to do short neck. Effleurage 2 to 3 times. And this is to stimulate parasympathetic and sympathetic system. And we're going to do swimming in the terminus over the venous angle, stimulate the subclavian and internal jugular vein 5 to 7 times. We're going to do profundus terminus, which is going to be at the base of the earlobe with stationary circles towards venous angle 5 to 7 times. If we have a long neck, we can do 2-hand placement. No palm, no thumbs. And we're going to also do shoulder collectors, starting at the acromion 5 to 7 times, and then we move towards the neck 5 to 7 times. So that will complete the short neck. Then you can do the abdominal techniques right after your neck. Actually, remember, you can do your abdominal technique anytime in treatment. Bring your legs up. You're going to ask your patient to do deep breathing. And you're going to go position number 1 over the umbilicus. You're going to push when exhaling. And when she's inhaling again, you're going to hold it 1 second. Move to the second position. Go down. If you feel the pulse, you just stop there. 1 second to stretch. Number 3. Exhaling, you go all the way down. Hold it for 1 second when she's inhaling and move your hands to the next position. Number 4. Go down, hold it 1 second, let go to the next position, and you do that for 9 positions starting on the left side of the body. Hold 1 second. Go now to the right side, along ribs in the abdominal area. I'm going to push 1 second when she's inhaling. You need to let the patient know what you're doing. 1,000, move to the number 8, which is the same as number 6. And then last one is number 1, which is the same as number 9 for the 9th position. Hold it 1 second and let go. Then I'm going to start treating the healthy quadrant, which is going to be the right side. So I need to go to the other side, and I'm going to stimulate axillary lymph nodes on the right side. Five times. And since we're not working the trunk, we're going to open the anastomosis, the AAA, anterior axillary anastomosis. Going to find the healthy portion of that anastomosis, and we're going to do 5 to 7 on the healthy portion of the anastomosis towards the right axilla. In this case, left, it's swollen. Second hand position will be on the swollen side of the AAA of that anastomosis. Bimanual stationary circles. And the third step to open this anastomosis will be from axilla to axilla. So we want to go from the left swollen axilla with dynamic stationary circles across the entire anastomosis, the entire AAA. And again, you want to do this 5 to 7 times. This is my second time. So you'll do that 5 to 7 rows, tracks, in the same AAA. Then after I have opened AAA, I need to open now AI. You can bring your leg up, down. And I'm going to stimulate inguinal lymph nodes on the ipsilateral side. Find the ASIS down to the groin, put my hands to do a bimanual stationary circles on the femoral triangle. So now my MCPs are lining with the sartorius muscle. 5 to 7. Second hand position. Move your hands distal and medial. And you do 5 to 7, stimulating left inguinal lymph nodes. Then again, since we're just treating the arm and not the trunk, we're going to now open the AI anastomosis. We'll go to the other side. Just stimulated the inguinal lymph nodes on the ipsilateral side. To open the AI anastomosis, I find the lower horizontal watershed. Healthy side of that anastomosis will be below the lower horizontal watershed towards the inguinal lymph nodes. And I'm going to do bimanual stationary circles towards the inguinal lymph nodes that I just stimulated. My second hand position will be above the lower horizontal watershed on the swollen side of the anastomosis, and I'm going to stretch, and directional stretch will be towards the inguinal lymph nodes. And the third step will be dynamic stationary circles from the axilla towards the inguinal lymph nodes across the AI on the left side, which will be the ipsilateral side. We do this also 5 to 7 times. So now we need to put patient in sideline to open PAA, but before we do that, I'm going to rework AAA with dynamic stationary circles once or twice, and we're going to rework shoulder collectors and AI, which we can do that in sideline. So we can put our patient sideline with the upper extremity left on top, the swollen extremity on top. So I'm going to go to the other side to rework AI. Remember, the rework will be just the third step of opening the anastomosis with dynamic stationary circles from axilla to inguinal. And I can rework shoulder collectors from behind. 2 hands, position on the shoulder collectors towards the neck. Perpendicular stretch and directional stretch towards the neck 5 times on a stationary circle. And now I'm going to open the PAA anastomosis, which comes from axilla to axilla. Cross sagittal, my hands are on the healthy side of the anastomosis. Same thing we did with the AAA, now in the posterior axillary anastomosis 5 to 7 times. Swollen side of the anastomosis, you don't need to put patient in prone to do this, you can do it on sideline. And then 5 to 7 from swollen to healthy. So we're going to go dynamic stationary circles from axilla, in this case left to right. I'm going to do this 5 to 7 times and open the PAA. Then after we prepare the trunk with the anastomosis and the lymph nodes, we're going to start working with the arm. So we can put the arm on the side, and we're going to do the first thing we can do is an effleurage. You can do it with the tip of your fingers or with your nails all the way up towards the neck. We want goosebumps 2 to 3 times. Then you can do hand washing or stimulating the bulk flow of the shoulder on side to side of the shoulder, anterior and posterior deltoid muscles. And you can also do a hand washing extended towards the AAA and the PAA, and that will rework the anastomosis, the AAA and the PAA. In front, we can leave it at the sagittal watershed, and in the back you can go all the way down towards the table. Then the lateral upper arm, we can do all the strokes, pick up 1 or 2 of the strokes and do 5 to 7 rows to stimulate the lateral aspect of the upper arm. And I'm using pumps and stationary circles, combination of pump and stationary circles. You can also do dynamic stationary circles. And with a bigger arm, you can even do rotaries. Then after the 5 to 7, you can extend it and rework shoulder collectors towards the neck. So after we have worked the lateral aspect of the arm, upper arm, we're going to change position again, and before we change position, we want to rework. So we can rework shoulder collectors. We can rework PAA, and remember, once or twice is good. You're just going to go from swollen towards healthy along the entire anastomosis. You can rework AI, axilloinguinal anastomosis towards the inguinal lymph nodes. Then you can put patient supine on your back. And we can rework AAA. Once or twice. And you can also rework axillary lymph nodes once you're here. 5 times on the healthy side. Then you're going to put in here the arm sequence, which is going to be reworking the lateral aspect of the arm. You can do that with pumps. Perpendicular stretch and directional stretch towards the shoulder. You can always rework shoulder collectors. Then you can do the medial aspect of the arm with a special technique to push fluid from medial to lateral. And this is done 5 rows in the proximal side of the upper arm with dynamic stationary circles. And we're going to do this 5 times. And at the end of the 5th time, let's say this is the 5th time, we're going to pump the fluid that we have moved from medial to lateral with pumps towards the shoulder collectors. Then we're going to do that 1 hand width more distal. And we're going to move again the fluid from medial to lateral. You can sit down in a chair to do this. This can take you a few minutes. And at the end of the 5th row, you're going to do, again, pumps from where you left off, all the way up towards the shoulder collectors. And you can always rework shoulder collectors towards the neck. Then we can do the vasovasorum technique, which is going to be in the delta pectoral groove. I'm going to find the groove, which is going to be between the pecs and the deltoid, and we're going to push towards the neck. And this will stimulate the vasovasorum of the cephalic vein 5 times. Then we continue working the arm. So we're going to do now thumb circles or stationary circles and the antecubital fossa from 1 inch below to 1 inch above the joint. Or you can always use stationary circles, dynamic stationary circles, one-handed. And then move down to the forearm. And you can do scoops in the forearm. You need to treat anterior and posterior. You can do 1 or 2 handed. I'm treating now the posterior forearm. I have to start at the anterior, and then I need to pronate to go to the anterior forearm, starting at the posterior forearm. But you can also use other strokes like pumps. You can do pumps, perpendicular stretch and directional stretch towards the elbow. And you can use combination of dynamic stationary circles. You need to treat anterior and posterior trunk, forearm. Or you can do pump and stationary circles. And this is what we call pump push. Then after you're done the forearm, anterior, posterior, then we do the dorsum of the hand. And you can do that with thumb circles towards the wrist. Or you can also use dynamic stationary circles towards the wrist. Remember, all these strokes we do 5 to 7 times. Then after we do the dorsum of the hand, we could also work the palmar aspect of the hand with thumb circles, ulnar radial aspect, and descending and mesothenar towards the edge of the hand. And then we can also use thumb circles to do each finger. Usually we do not do the fingers with lymphedema patients. We do the wrapping of the fingers to help with the swelling of the fingers. So after we've done this, now we're going to rework. So you're going to pick up your best stroke and come all the way up towards the elbow. I'm using scoops, anterior, posterior arm, forearm, and when I get to the elbow, I'm going to continue with pumps, and I'm going to leave it at the lateral aspect of the upper arm with our lymphedema patients. And I'm going to take it all the way up towards the shoulder collectors. So now basically I'm done with the arm treatment. I need to rework. So I'm going to rework AAA from swollen to healthy. Once or twice. I'm going to rework axillary lymph nodes. My pinky finger of the right arm is at the axillary fold. I need to rework all the anastomosis and all the lymph nodes that we stimulated at the beginning. So I'm going to also do the inguinal lymph nodes on the ipsilateral side 5 times because it's a stationary stroke. 2-hand position. And then I'm going to ask her to go one more time on her side with the left up to rework PAA. And that will be from swollen to healthy with dynamic stationary circles. And keep your stroke 1 second on the working face. You can also rework AI from here. Sideline from axilla to inguinal, following the AI anastomosis towards the inguinal lymph nodes, at least anterior to the ASIS. You can rework shoulder collectors towards the neck. You can do an effleurage on the arm towards the neck. And then you can put your patient back supine on your back and finish with another abdominal technique. So bring your legs up. I'm going to do our last abdominal technique. If we're doing it again from the left side, you're going to start on the left side of the abdominal cavity, along the ribs. Remember to leave it 1 second when she starts inhaling again. Move to the next side. Number 3. 1 second. 4. 5. You're gonna go down with exhalation. Gonna hold it 1 second when she's coming back. Move to the next step. Number 6. Now hold it 1 second. You can pivot on your fingers, go to the next step, number 7. Eight. Exhale. Hold it 1 second. She's inhaling back. Move to the next position. Number 8. The one on top, the hand on top is pushing. The one in the bottom is just holding. Passive. And you finish the sequence with an abdomen. This is bilateral upper extremity lymphedema with trunk involvement. So we're not going to treat the arm yet, only the trunk, both sides, upper quadrant. So we're going to start at the neck. So we're going to do the short neck again. This is the first thing we always do with the sequence. Stimulate ANS from the sternal notch towards the acromion. Then we're going to do the swimming in the terminus. Terminus is going to be the venous angle, and that's subclavian vein with the internal jugular. Stimulate the terminus, the end of the lymphatic transportation. Then we're going to do the profundus terminus at the lateral cervical triangle. And again, everything's done 5 to 7 times at least. 2-hand position if you have a long neck. No palm, no thumbs. And we're going to do shoulder collectors, starting at the acromion towards the neck, simultaneously dynamic stationary circles towards the neck. Then, like with every sequence, we're going to do an abdominal technique. It could be done now or before we put patient prone. For the anastomosis, we're gonna open both AIs. So we're gonna start with the inguinal lymph nodes on the same side you're standing. Find ASIS, go down to the groin. We're gonna stimulate inguinal lymph nodes. Two hand position at the medial femoral triangle. Second hand position, more medial and distal, following the sartorius muscle 5 to 7 times. Then we need to open the AI anastomosis and to go to the other side. So now we're opening AI. We started below lower horizontal watershed bimanual stationary circles. Stationary circles. This is the first step of opening the anastomosis on the healthy quadrant. Second hand position will be on the swollen side of the quadrant above the lower horizontal watershed. Hands perpendicular to the collectors 5 to 7 times. And then from axilla to inguinal with dynamic stationary circles, following the AI anastomosis, cross lower horizontal watershed towards the inguinal. So at least medial to the ASIS across the entire anastomosis, 5 to 7 times. Then since we're treating the trunk, I'm going to stay here and treat intercostals. I'm going to treat the trunk with intercostals. So I'm going to find the intercostal spaces, put my fingers flat in between the ribs, and do intercostal waves using the perforating precollectors to the deep system. We're going to do that every place we find ribs. We're going to treat the involved quadrants. We can also do parasternals on the swollen side. Find the intercostal space in the sternum, swollen side, and I'm going to push in and wave towards me to stimulate the parasternal lymph nodes. And we can also do the reverse technique of 7, which will be above the umbilicus, over the sagittal, unswollen towards swollen. But when I get to the AI, I'm going to reverse the technique of 7 towards the inguinal lymph nodes. So that way I'm treating the entire quadrant with rotaries towards the AI. Once I hit the AI, I do dynamic stationary circles towards the inguinal. Then I'm going to stimulate inguinal lymph nodes on whichever side you're standing, because you're going to do both. Go ASIS to the groin, MCPs over the sartorius, and you're going to stretch and direct towards inguinal lymph nodes 5 to 7 over the femoral triangle. 5 to 7, then move your hands more distal and medial. Do it again inside the femoral triangle, stimulating inguinal lymph nodes. Then after we stimulate inguinal lymph nodes, we're going to open AI on the other side. So I move to the other side, do the same thing we just did in this side. This is lower horizontal watershed. This is the healthy side. And I'm going to do first step of opening the anastomosis on the healthy quadrant towards healthy lymph nodes. In this case, inguinal lymph nodes are healthy. Second hand position above lower horizontal watershed on the healthy side of the anastomosis. Perpendicular stretch directional towards inguinal lymph nodes, 5 to 7, and then the third step will come from axilla all the way across the AI towards the inguinal lymph nodes, across the AI anastomosis, and we're going to bring it all the way down to at least medial to the ASIS. This is the third step of opening the anastomosis, so we're going to do this 5 to 7 times from axilla to inguinal. And after we open the anastomosis, we're going to treat the swollen quadrant. So we can start with intercostal. So you can do intercostal waves, find all the spaces between the ribs, intercostal spaces. We're going to send fluid from superficial to deep 5 times. We can do from lateral to medial and move towards the sternum. You can also use your intercostal waves if the patient has had a mastectomy and the mammary gland is not there. So everywhere you find ribs. And again, this is on the swollen quadrant. Then we do the parasternals. We're going to do it again over the intercostal spaces in the parasternals. And we're stimulating the parasternal lymph nodes. We're going to have at least 6 spaces. 5 to 7, and then we're going to do the reverse technique of 7. Same thing we did on the other side. And this is rotary techniques, bimanual, all the way to AI, and then inguinal, dynamic stationary circles. So remember, we do this 5 to 7 times. This is my second time. Combination of rotary techniques all the way down to AI, and from axilla towards inguinal, from swollen to healthy. So we'll do this 5 to 7 times. We're ready to put patient prone and work on the posterior trunk. But before that, we want to rework both AIs, so we can do that at the same time. From axilla, across AI, towards inguinal, once or twice. And we can also rework shoulder collectors towards the neck. Do 5 times, and then 5 times close to the neck, reworking both shoulder collectors. And before we put the patient prone, we can do an abdominal technique. So bring the legs up. And we are going to do the 9 deep abdominal technique. Ask our patient to take deep breaths. And we're going to start number 1 at the umbilicus. 1 second stretch when patient is inhaling, exhaling, going down, inhaling, 1 second stretch. Next position, number 3. We're going to start on the left side. 1 second stretch, number 4. And this is going to stimulate the deep lymphatic system. 1 second. Also stimulates the thoracic duct, cisterna of Kylie, lumbar trunks, GI trunk, and all the intestines with the lymphatics. 1000, go to number 7. Exhale, go all the way down. Hold it for 1 second when she's coming back up and move to the next step, number 8. 1000, she's inhaling. And number 9, go down with exhalation. 1000, 1 second stretch and let go. So now we're ready to put patient prone. We have done all the rework of the anastomosis. And now we're going to treat the posterior trunk. All right, so we turned patient prone to work on the upper quadrant that's involved, both upper quadrants. There's no anastomosis to open here. We're going to do intercostals. So same thing we did in front. We're going to now treat the posterior trunk. I'm going to do from lateral to medial, intercostal waist. And again, we are pushing fluid from superficial to deep. The hand that's touching the patient's passive. And I'm putting the pressure with the hand on top. And we're going to do that 5 times, wherever we can find the intercostals. And then the paravertebrals from T2 to T12. Find the spinal processes, move away from those. And we're going to push in and wave towards you. Your fingers, we're going to do this with the finger pads, not with the fingertips. 5 times and do it all the way to T12. And again, we are stimulating the paravertebral lymph nodes. Now we can also do the reverse technique of 7 in the swollen quadrant. We'll ask the patient to frog leg, bring the leg up. Reverse technique of 7, we're going to do above T12. I'm going to position my hands on top of the sagittal watershed and do bimanual rotaries. And I'm going to look for AI. So I need to really go all the way down the table. This is why we open the position of the leg towards inguinal lymph nodes, all the way down to ASIS. And we do that 5 to 7 times again. So each 7 will be 1 time. Go all the way down to the AI with rotaries. And from the A, from the axilla, towards the inguinal with dynamic stationary circles. Now we need to do this on the other side. So we are treating bilateral upper extremity lymphedema with trunk involvement. Find the ribs, intercostals. My hands are going to be between the ribs, pushing from superficial to deep system. So we'll do the same thing we did on the other side, 5 times. Each space where we find the intercostals, pushing fluid from superficial to deep, until we get medially towards the paravertebral lymph nodes. Find the spinal processes, move away from the spinal processes, and I'm going to push in and wave towards me to stimulate the paravertebral lymph nodes 5 times, and then move up. You can start up or down, it doesn't matter. You can start at T2 or you can start at T12 and then move up. And I'm going to go 5 times to stimulate paravertebral lymph nodes. And then finish again with the technique of 7, reverse towards the inguinal lymph nodes. So above T12, you can ask your patient to frog leg. And I'm going to do rotaries. And this is going to go all the way down to AI and dynamic stationary circles towards inguinal. This is the reverse technique of 7. So it will go opposite of what we did with the healthy quadrant. We'll go towards the healthy lymph nodes. In this case will be inguinal. So again, technically we are done with treatment. We just need to rework everything that we had opened and stimulated. From prone, we can put patients side-lying, either side, because we're going to rework AIs. We're going to rework both AIs and both shoulder collectors. So you can take advantage of the side-lying position to rework AI on top. And then you're going to rework the other AI when patient's supine. We can also rework shoulder collectors. Five times, and then we're going to put patients supine. We're going to rework the other AI anastomosis, axilloinguinal anastomosis. You can rework inguinal lymph nodes. On this side, remember when you're reworking, it doesn't matter the order in which you rework. You can rework the anastomosis first and then the lymph nodes. If you're opening the anastomosis, and you have to do first the lymph nodes and then the anastomosis. So we're reworking. So we did the inguinal lymph nodes, we did the AI on this side and the shoulder collectors. Now we go to the other side and do the inguinal lymph nodes on the other side. 5 times on the femoral triangle, 2-hand position. And all I have left is shoulder collectors on this side. You can do both at the same time, or you can just do the side that you had not done. 5 times. And then you can finish with another effleurage. You can effleurage both arms towards the neck, because you want to apply bandages to both arms ideally. And finish with another abdominal technique. So you bring the knees up. And you can do another deep abdominal, starting in the umbilicus. The 9 position. When you do the deep abdominals, try to follow patient breath. 1 second to stretch when she's doing inhaling, inhalation. 1,000, coming back to number 5. I'm going to hold it 1 second, go to 6. Holding up. 7. Remember, you can do abdominal techniques, whatever you want during treatment. You can do it at the beginning, the middle, at the end. At least twice on each of the treatment sequences. And number 9. One 1,000 and relax. And this has completed the upper extremity lymphedema with So we're going to do the bilateral upper extremity lymphedema without trunk involvement. So the trunk is being decongested, and now we're going to take care of one arm at a time. So let's say the left is the worst arm, so we're going to decongest the left first. So we're going to do a fleurage at the neck, the short neck, 2 to 3 times. We're going to do the swimming in the terminus. And this is going to be 5 to 7 times, stimulating the venous angle. We're going to do the profundus terminus, stimulating the cervical triangle. You can do 2 hand placement for long necks. And you're going to do the shoulder collectors, starting at the acromion, 5 to 7 times, and moving into the neck, 5 to 7 times, with the direction of stretch towards the neck. Radial deviation. Then again, we're going to do the abdominal technique, which can be done at the beginning or in the middle of the session when your knees up. And we're going to do the deep abdominals. Second hand position will be on the left side. And this is going to stimulate the deep lymphatic system in the abdominal cavity. I'm going to do the 9 position, pivot in our fingers. 1 second stretching to inhaling. Number 5. And we move towards the ascending column. Number 7. Stimulating deep system. 8. And 9. Take a deep breath. Exhalation, we go all the way down. When she's starting to inhale again, I'm going to make a little stretch and let go. Now we're going to treat both arms. The sequence of the bilateral upper extremity lymphedema, you need to stimulate both AIs. So I'm going to stimulate both inguinals. So you're going to start with the first that's closest to you, because we're going to be doing both. And this is inguinal lymph nodes in 2 hand placement, bimanual stationary circles. And then I'm going to open AI, go to the other side. We are going to open the anastomosis, the AI anastomosis. So my hands are going to be below lower horizontal watershed towards the inguinal lymph nodes with bimanual stationary circles. Step 1 of opening the anastomosis. Second hand placement will be on the swollen side above the lower horizontal watershed, above the lower horizontal watershed towards inguinal. And the third step will go across the entire anastomosis from axilla towards inguinal. Dynamic stationary circles from axilla to inguinal. Again, this is done 5 to 7 times. Then after I open AI anastomosis, I need to do it on the other side, because we're treating bilateral upper extremity lymphedema. So I'm going to go to inguinal lymph nodes on this side, on the femoral triangle, bimanual stationary circles, 1,000, 1 second per working phase for your strokes. And I'm going to do 2 hand placement, 5 to 7 times. And then open the anastomosis on this side. I have to move to the other side. Now we're going to do the same thing we did in this side. We're going to open the anastomosis, find your lower horizontal watershed. Your hands are perpendicular to the collectors. And now we're going to do bimanual stationary circles. This is the first step of opening the anastomosis towards inguinal. 5 to 7. Second step, we go perpendicular to the collectors on the swollen side of that anastomosis, of the AI anastomosis. 5 to 7, and the third step will come from axilla across the entire anastomosis towards the inguinal. And again, this is the first time we're opening this anastomosis, so we need to do it at least 5 to 7 times from axilla to inguinal. So since we're not treating the trunk, we're just going to rework both anastomosis from axilla to inguinal. And you can do them at the same time. When you get closer to the umbilicus, you need to change your hands so you're perpendicular to the collectors. And you want to take that all the way down to at least the ASIS, the anterior superior spine of the iliac. And this you're going to do once or twice. Reworking both AIs. And again, since we're not treating the trunk, we're going to start working with extremity that's most congested. So we can either leave the patient supine or put patient sideline with the worst extremity on top. We say we can put patient sideline to rework the AI. From axilla to inguinal. And we can also rework shoulder collectors from behind towards the neck. And then start working on the worst extremity. So we decided left was worse than right. So we're going to put left on top. And we're going to start working with the left arm. So remember, we already decongested the trunk So we're going to start working with the arm. Even though we're working with one arm, we still open, activate both anastomoses for both arms. So we're going to start with the bulk flow at the shoulder, doing the hand washing. Now my hand washing does not extend towards PAA and AAA, but towards the neck, because we are not going to use the AAA and the PAA. So you can start doing hand washing, and when you extend the hand washing, it will go towards the shoulder collectors, towards the neck, because we do not want to use the AAA and the PAA. Then we're going to work on the lateral aspect of the arm, and we can do that with pump push. We can do it with dynamic stationary circles, pumps, or rotaries. So you can pick up your best stroke and do 5 to 7 times. The directional stretch goes towards the shoulder, and you can always extend towards the shoulder collectors, towards the cervical lymph nodes. You can do pumps. And or rotaries towards the shoulder. So in reality, you're going to do one of these strokes 5 to 7 times. Then ready to put patient supine, we're going to rework again the shoulder collectors. We're going to rework AI, so axilla towards inguinal. You want to rework every time you change patient positions. Rework once or twice. And the rework is the third step of opening the anastomosis. And now we can rework the other side by putting the patient in supine. Then we're going to rework AI on the opposite side. Once or twice. Or you can always rework both at the same time from axilla. And rework shoulder collectors. 5 times, 2 hand position. Then we're going to continue with the arm treatment. So we can put in here the same arm treatment that we did at the beginning. So we'll be special technique on the medial aspect towards the lateral aspect. And you're going to do that in 5 rows. At the end of the 5th row, you can do pumps from where you left off towards the shoulder collectors. You can do one hand with distal and do it again. So first treatment, you may not go all the way up, down to the arm, to the hand. You may spend more time at the upper arm. And then at the end of the 5th row, pump. And you're going to do several hand placement depending on the length of the upper arm. You can always rework shoulder collectors at the end. You can also do the vasovasorum of the cephalic vein. You can rework the lateral aspect of the arm. All the way towards the neck. And then continue distal with bottleneck, antecubital fossa with thumb circles or stationary circles. And again, every area is worked 5 to 7 times, at least. Scoops or dynamic stationary circles. You can also do pumps. So you pick up one strokes and do it 5 to 7 times. You need to cover anterior and posterior forearm. Then you're going to do the dorsum of the hand, and you can do it with thumb circles. From the knuckles towards the wrist, or you can do that also with stationary circles. Remember, each one of these strokes you're going to repeat 5 to 7 times. And then the palmar aspect of the hand with thumb circles. From the middle towards radial and ulnar. This is descending and mesothenar bundles. And you can do fingers across and towards the knuckles. Across towards the knuckle. You're going to do each finger 5 to 7 times. You can stabilize at the DIP. Now we said with lymphedema patients we usually do not spend time doing this because we're going to do the wraps of the fingers. So then after this we rework. So we rework the dorsum of the hand. We rework the forearm. Can be done with scoops or pump and stationary circles. We can rework the upper arm with pumps. Relax. The rework will be once or twice, just to bring it all the way from distal to proximal. Keep up the lymphangial motoricity. And we're going to rework the shoulder collectors. So again, we're done with the arm treatment, so we just need to rework. So we can rework both the eyes. At the same time, once or twice. We can rework inguinal lymph nodes. Five times, 2-hand position. And all that's left to rework is the right inguinal lymph nodes and an effleurage to both arms towards the neck. So I rework the other inguinal lymph nodes. 2-hand position 5 times. We can do another effleurage on the other involved arm. Even though we didn't touch this arm, we're still going to do effleurage and do a bandaging of both arms ideally. And finish with an abdominal technique. So bring your legs up. We're going to do the last abdomen. So we said the abdominal techniques are going to stimulate the deep lymphatic system. Seven. Eight. And last breath. And we have finished the sequence of bilateral upper extremity lymphedema without trunk involvement. Okay, we're going to do the unilateral upper extremity lymphedema with trunk involvement. So we're going to say the left side is involved. We have a left upper extremity lymphedema with trunk involvement. So we're going to start with the neck. We're going to do effleurage. We're going to do short neck. Effleurage 2 to 3 times. And this is to stimulate parasympathetic and sympathetic system. And we're going to do swimming in the terminus over the venous angle, stimulate the subclavian and internal jugular vein 5 to 7 times. We're going to do profundus terminus, which is going to be at the base of the earlobe with stationary circles towards venous angle 5 to 7 times. If we have a long neck, we can do 2-hand placement. No palm, no thumbs. And we're going to also do shoulder collectors, starting at the acromion, 5 to 7 times, and then we move towards the neck, 5 to 7 times. So that will complete the short neck. Then you can do the abdominal techniques right after your neck. Actually, remember, you can do your abdominal technique anytime in treatment. Bring your legs up. You're going to ask your patient to do deep breathing. And you're going to go position number 1 over the umbilicus. You're going to push when exhaling. And when she's inhaling again, you're going to hold it 1 second. Move to the second position. Go down. If you feel the pulse, you just stop there. 1 second to stretch. Number 3. Exhaling, you go all the way down. Hold it for 1 second when she's inhaling and move your hands to the next position. Number 4. Go down, hold it 1 second, let go to the next position, and you do that for 9 positions starting on the left side of the body. Hold 1 second. Go now to the right side, along ribs in the abdominal area. I'm going to push 1 second when she's inhaling. You need to let the patient know what you're doing. 1,000, move to the number 8, which is the same as number 6. And then last one is number 1, which is the same as number 9 for the 9th position. Hold it 1 second and let go. Then I'm going to start treating the healthy quadrant, which is going to be the right side. So I need to go to the other side. And I'm going to stimulate axillary lymph nodes on the right side with bimanual stationary circles, 5 to 7. Then after I stimulate the axillary lymph nodes, I'm going to stimulate the healthy quadrant, which is the right upper quadrant, with effleurage towards axilla. And you want to try to incorporate the entire quadrant, which is between lower horizontal watershed and upper horizontal watershed. Then after the effleurage, we treat the mammary gland. And we do that with pumps at the base of the breast and rotaries over the AAA. Another pump, another rotary, and the last pump at the base of the areola. With the last rotary, you can do a stationary circle or a thumb sweep towards the axilla. And again, you're going to do that 5 to 7 times. And this is going to treat the mammary gland of the healthy quadrant. Pump and rotaries. Then we're going to treat the lower part of the upper quadrant with a combination of rotaries and dynamic stationary circles. So we're going through the plexus until we hit IA, and from IA, dynamic stationary circles towards the right axilla. And then you're going to do this 5 to 7 times. This is what we call technique of 7. Technique of 7 is done on healthy quadrant towards healthy lymph nodes. Then after we treated the healthy quadrant with healthy lymph nodes, we're going to open the anastomosis. So we're going to open AAA, which comes from axilla to axilla, start on the healthy side of the anastomosis towards healthy, with bimanual stationary circles, no pump, no thumbs, 5 to 7 times. And then we're going to move towards the swollen side. And then the third step of opening the anastomosis will be from swollen axilla, from left, in this case from left to right. Dynamic stationary circles across AAA towards healthy. And remember, you also do these 5 to 7 rows, 5 to 7 times. This will be my second time. So after you're done with the healthy quadrant, now we're going to treat the swollen quadrant. And we're going to start with the inguinal lymph nodes on the ipsilateral side. So you can bring your legs down and expose medial femoral triangle. Find the ASIS, go to the groin, and I'm going to do bimanual stationary circles on the inguinal lymph nodes, which are in the femoral triangle, medial femoral triangle. 5 times, move my hands distal and medial, and do it again. So I'm going to stimulate inguinal lymph nodes so I can send from the left side towards those inguinal lymph nodes through the AI. So after I'm done with the inguinal lymph nodes 5 to 7 times, I'm going to open now the AI anastomosis. Go to the other side. AI anastomosis from the lower horizontal watershed. This will be healthy. So we're going to do healthy side of the anastomosis 5 to 7 times. Then move to the swollen side of the anastomosis. We're working on the AI. And again, everything's done 5 to 7 times. And then we're going to go from swollen across the AI, across the lower horizontal watershed, towards the inguinal lymph nodes. So bring it at least towards ASIS, medial to the ASIS. And again, you're going to do that 5 to 7 times. After I open AI, I'm going to treat the swollen quadrant. And the swollen quadrant is treated with intercostals. So I find the ribs, put my fingers between the ribs and the intercostals, and I'm going to do intercostal waves on the swollen quadrant. Every place I have ribs that I can find. If this is a mastectomy patient, you may not have the mammary gland, so you can do it on top of the breast, on the ribs. And you're going to do that 5 until you get to the middle, to the sternum. And you're going to go and do this parasternal lymph nodes. Find the clavicle, find the spaces between the ribs at the parasternals, and you're going to push, and all this is done on the swollen quadrant. Okay. Now, after we're done the anterior trunk, we're going to rework. So we're going to rework from left to right, AIA. And when we rework, once is good, twice is nice. So you can do it once or twice. From swollen to healthy. And then you can rework AI from axilla to inguinal across the entire anastomosis, only the third step. You can also rework shoulder collectors from supine or from saline. You can rework both shoulder collectors. And then I'm going to ask Chris to move on her stomach to treat the posterior trunk. So I'm going to start with the effleurage, treating the healthy quadrant. Effleurage will go from PAA and then lower towards the axillary lymph nodes, following the collectors, lower horizontal, 2 to 3 times each track. Then I'm going to follow the same tracks, and I'm going to do rotary techniques towards the axillary lymph nodes. And we're doing this on the healthy quadrant, towards healthy lymph nodes. And we're going to change our hand position so we can cover the entire quadrant, which is from T12 to around T2, towards healthy axilla. Remember, each one is going to be done 5 to 7 times. Then we're going to find T12, and we're going to do the technique of 7, where you may ask your patient to frog leg so you can get into the anterior IA, in this case, and from I towards the axilla. And this will be the technique of 7, healthy quadrant, posterior trunk. Then after you're done your healthy quadrant with the effleurage, the technique of rotary techniques towards the axillary lymph nodes, and the technique of 7, we're going to open, activate the PAA. You're going to find your PAA, divide that in healthy and swollen, and you're going to do healthy towards healthy with bimanual stationary circles, 5 to 7. Then you're going to put your hands on the swollen quadrant and the swollen portion of the anastomosis, and we're going to do 5 to 7. And then the third step of opening the anastomosis will be from swollen to healthy. So I'm going to come all the way from axilla with dynamic stationary circles, no palms, no thumbs, towards healthy axillary lymph nodes. You can finish with one hand all the way down to the table. And again, you're going to do this 5 to 7 times. Then after I'm done with the healthy quadrant, I need to work on the swollen quadrant. So I'm going to move to the other side. I'm going to treat intercostals. Every place I find ribs, I'm going to stimulate, so we can stimulate the deep system, and that's going to be the intercostal collectors, through the perforating precollectors to the intercostal collectors. I'm going to do 5 each position. Skip the scapula until you go from lateral to medial. You can use every space that you can find ribs in the back. And then another technique you can do in the swollen quadrant is the paravertebrals. So you're going to find T2, find the vertebrae, spinal processes of the vertebrae, and you're going to go away from those, between the muscle and the bone, more into the facets. And you're going to push in and wave towards you. You're only going to do this from T2 to T12 on the swollen quadrant. So technically I'm done with treatment. I just need to rework everything I work at the beginning. So I'm going to effleurage the healthy quadrant. I'm going to go from left to right through the PAA. Once or twice. You're going to put your patient sideline with the swollen extremity on top. We reworked PAA in prone, but we can also rework PAA in sideline from swollen to healthy across the entire anastomosis with dynamic stationary circles. We can also rework the IA from swollen to healthy towards the axillary inguinal anastomosis, towards the inguinal lymph nodes. You can stop at least at the medial of the ASIS once or twice. And you can also rework shoulder collectors from this position before you turn your patient supine. Shoulder collectors can be reworked from behind. Patient bimanual stationary circles, 2 hands at the same time, towards the neck. 5 times. When you rework a stationary stroke, you can do that 5 times. And then you bring patient supine on your back. So I'm going to continue reworking. I'm going to rework AAA from left to right, across the anastomosis with dynamic stationary circles. Once we're here, we can also rework axillary lymph nodes I'm going to do that 5 times. We rework shoulder collectors when she was sideline, and we rework AI. So all we have left is rework inguinal lymph nodes on the same side. Two hand placement, 5 times each. And we can finish this treatment by doing an effleurage on the healthy quadrant, effleurage the involved extremity towards the neck, and with another abdominal technique. So bring your legs up. And we do another abdominal. If you're doing it from the left side, you can start your hands on the left side. So remember, when she's inhaling, you're going to keep it 1 second and do that extra stretch. She's inhaling, I'm going 1,000, and move to the next step. Always start on the left side of the abdomen. The hand that's on top is the one that's putting the pressure. The hand that's against the skin, it's passive. Hold it 1 second. Move to the next breath. Inhaling, holding 1 second. Number 8. Hold it and take a deep breath. And number 9.